Hello, and welcome back to our journey for better health and fitness in our golden years. Today I have a special guest. I have with me Dr. Kevin Lyter, who is my chiropractor and friend.
Yep.
And I have been coming to your office in Tacoma, Washington for I don't even know how long.
Oh gosh.
I don't even know how long. But
15 years?
Yeah, more. You have helped me through some health crisis more than once. And I just really want you to be recognized for that right at this point.
Oh, well,
yes.
Thank you. It's been our pleasure for sure.
Yes, we've had so much fun. And all these years, I would be waking up with different ailments. When we get to be our age, we wake up with different ailments that we didn't have when we went to bed, right? But I would wake up and the room would be spinning. And I knew my first thought is, I gotta go see Dr. Lyter. And you helped me, so thank you. And I've had a couple of times where I was out of whack. I don't know if it was my hip that was out or what was going on, but I was bouncing into the wall. I had no balance. And I knew I needed to come here, and you helped me out. So why don't you explain to our audience a little bit about the importance of nerve health, spinal health, especially as we get into our golden years?
All right. Well, thank you so much for that. And it's absolutely been our pleasure to have you here with us and to help you out. I got into chiropractic because I wanted to help people have natural health. The body is designed to work properly and work well for a lifetime. And I believe that if we get it and keep it in the way that it's designed to be, that people are going to have good health and they're going to be able to do the things that they want to do. So the focus of chiropractic is really on having a healthy nervous system, because the nervous system directly or indirectly controls every function in the body. And the master control center for that is, I've got this model here that is part of the skull and then into the spine right here. And we've got some nerves coming out right here, we'll talk about, and we have some blood vessels right here that we'll talk about. But the brain sits right up in this area, right in through here. I don't have the whole model, just this portion of it. But the brain is really the master control center for everything that happens in our body. Okay, and our job as chiropractors is to make sure that the signals from that brain are going down properly through your spinal cord and then out through spinal nerves that come out at every level of the spine to communicate with every part of your body to make it work like it's supposed to work. And that's what we're doing as chiropractors, is we're finding areas where there is interference in that communication and in that system, and then we're applying adjustments. And here at our clinic, we do as gentle adjustments as we can, some of which are extremely gentle and very, very carefully targeted to allow that nervous system to communicate with the body as well as it possibly can. Because when you have 100% communication from the brain to the body back to the brain, and you have that for extended periods of time, that's one of the major things you're going to need to have excellent health and to keep your body functioning like it's supposed to function.
So let me ask you this, because one of the reasons I came here was specifically because I did not like to have my neck cracked. I know I shouldn't say that, but I didn't like that feeling, and I thought it was a little too much. Why don't you talk to me a little bit about Advanced Atlas Orthogonal?
Okay. All right. Well, thank you. Yeah. Here at Simmons Chiropractic, we use a technique called ADVO, or Advanced Orthogonal. And that technique, we very specifically analyze the alignment of your skull on the top couple of bones in your neck, and then the way those bones are relating to the rest of your spine. Because the most important area in your body for that nerve communication is right up here in this top part of your cervical spine, right up here in your neck, okay? That is the area where you can have the most interference from a misalignment of the spine affecting you in ways that really can be dramatic, okay? This area of the spine has a tremendous amount of motion in it, which is really important for us being able to turn our head and look up and down and move around, but it also creates the possibility of a weakness or misalignments that can irritate that system. So perhaps the most important part of your body that you've never really heard about is what's called the craniocervical junction. And that's where the cranium, or the skull, comes together with the top couple of bones in your neck. Now, one of the things Suzan was talking about is how she would wake up and she would feel dizzy or have some vertigo. Very, very commonly, that problem is being caused by a misalignment of these upper vertebrae in here. And in our office, we do, as I said, a very specific analysis using x-rays of the alignment of those vertebrae. It allows us to create a formula to do a very, very specific correction of those misalignments. And it's an extremely gentle procedure. We use an instrument, a table that the patient lies on, and it's a little scary looking. But what I tell people when they feel any nervousness about it at all is the amount of force we're going to be putting in their neck is so small. I used that instrument to adjust both of my kids when they were, one of them I think was 6 weeks old, the other was about 8 weeks old, the first time I used that instrument on them. So I tell them I'm going to be using an adjustment that I used on my children when they were tiny little babies, because it is so gentle. We can get corrections to that upper cervical spine with a minimal amount of force, and the amount of change that we get from that is dramatic because it has a huge effect on those signals coming from your brain down through your spinal cord and out through all those nerves out to your body. Atlas, or the top vertebra in the spine, and we're using that tiny little bit of force to get corrections to the alignment in this area, because it doesn't take very much to get this bone to move. This atlas bone is very different from all the other bones throughout the spine. At every other level of the spine, you have a spinal disc, and that disc really holds the bones into a certain amount of alignment. But there is no disc at the atlas. Between the skull and the atlas and what's called the axis, or the second bone of the neck, there is no disc. And so that joint is quite a bit more movable than some of those other joints. And it's a very light bone, it doesn't weigh very much. And when we go to correct it, even what look like big misalignments on an x-ray only need to move small amounts of distance, like maybe 1/8 of an inch is the distance we need to move that bone, or less in most cases, to get a huge change in the way that bone and its alignment is affecting that upper cervical spine. We can also get changes, and I've seen this in quite a few patients, really cool results, and actually what patients say after the adjustment sometimes tells us we're affecting this. We can get changes in this blood vessel right here. This is called the vertebral artery, and I know it's hard to see in there, but the vertebral artery actually goes through an opening in all the bones in your neck from the 6th cervical up, comes up to the atlas, this top bone in our spine, and it makes a number of 90-degree turns before it comes up and goes into your skull as what's called the circle of Willis right here. And when that bone gets significantly misaligned, it can cause irritation or pressures on those blood vessels and change blood flow to parts of the brain and into the spine itself, the spinal cord itself. So that's one of the other ways that correcting that upper cervical area can have a huge effect on people's nervous system and function. Misalignments in that area of your spine cause a tremendous amount of nervous system interference. We sometimes will even see changes in cerebral spinal fluid flow. People will say it feels like their head is draining, or they'll feel a flush as they feel blood flow changing through. I don't know if you've had that.
I've had the flush.
You've had that flush, yeah. And that's one of the very common things that patients will say. A lot of them will be like, oh, I know you got that right because I'm feeling that flush of that blood flow changing through my head. They can actually take your brain stem and wring it out a little bit, or put a twist on your brain stem. They also can put pressure on the very delicate nerves that exit the spine here and here. And they also can affect what are called the cranial nerves. That's 12 separate nerves that really innervate the head and into the upper parts of the neck, the mouth, the eyes, the ears. Those have cell bodies, or parts of those nerves that are in this part of your nervous system and your spinal cord. And misalignments of that upper area can cause twisting or pressure on those nerves and change the way that they function, typically with bad results.
What you're actually doing here, and I know this for myself, the machine, as you said, looks, what is that?
Yes.
But you don't really even touch the person.
That's right.
There's no manipulation that they can feel, no cracking, no moving, or anything like that.
That's right. It is very, very gentle. The most common thing that patients will say afterwards is, how did that do anything? And it's extremely gentle. There's a metal, what we call a stylus, on the instrument, and we set that just barely on the skin, or sometimes depending on the angle we're using, just off the skin. And you really don't feel it at all. You hear a bink sound. That's a number of my patients refer to it as the dink. They say, oh, I need to get the dink today, because that's the sound that it makes. And we're just aiming at a very specific point, and you're...
So now, it might sound like sci-fi here. Some people may be scared of this and worried about the safety of this. Is this safer than other chiropractic, or is this safe just in general, especially for us old people here?
Yeah, in general, it is really very, very safe. Most chiropractic adjustments are actually extremely safe. The newest research is coming out, even those adjustments that people don't like, manual hand adjustments of the neck, the newest research that's been done in the last few years shows that is actually extremely safe. But this adjustment is a million times safer than something that's already very safe. So it is a very, very light force that we put in there. Just recently, a gal in her 80s who was having problems that were very severe And she's about 1.5 years been having these issues. She started care with us about 3 months ago. She had tried a number of medical interventions, physical therapy interventions, which can be helpful, weren't helping her at all. And it was really actually very exciting yesterday. She came in and telling me that she was feeling better and she had hope for the first time in about 1.5 years. She actually had hope for her future, that she was going to be able to function like a normal person again. And that was just with that really gentle intervention in that upper neck.
And I think something to keep in mind, there could be a lot of mental improvement as well.
Oh, yeah.
Emotional improvement because of the master control center sending messages. And if they can't get to the message, you could have anxiety and other more serious problems that's on an emotional way. So it's not all just physical alignments that you, or benefits that you get from chiropractic care. I know that much.
I know this is one part of being healthy, a healthy person, having a healthy nervous system, having that communication from your brain to your body and back for you to work right. But I'm just excited about all these other videos that you're doing for people, because all these things that she's talking about are so vital. They're such important cornerstones and foundational parts of being healthy. The exercise is just so important. I really encourage all of my patients, and even especially people who, as they're getting older, like, you got to get out and move. You got to get that strength going, because if you don't do it, you're going to lose it. And at any age, we can build strength and stamina. At any age, it's a lie that you have to lose that as you get older. What we eat, of course, is just dramatic. It's so important. I see really neat changes in people as they change their diet. So thank you for doing those videos for people. Drinking enough water. Recently, I've been looking at sleep and how important that is a lot, reading some books on that. Getting appropriate rest is really important. And getting good exercise, having your nervous system right, that's one of the things we talk with patients about.
Flexibility.
Yeah.
If you can't get up out of a chair, or if you can't stand on one leg without losing your balance, that's very important, because you won't fall over if you have good balance.
That's right. So. And that is, that balance is that stamina, and that ability to feel even is one of the things we really do see improve in patients as we get their nervous system right. But that's that exercise too, getting out and walking every day and doing things. So those are great videos. So watch Suzanne's videos. She has amazing tips for you guys on how to be well.
Well, I thank you very much for your time, and I hope that you all learned something beneficial here that you could use in your quest for better health. And thank you. And until next time, be blessed and be healthy.
All right, thank you.